Study Cards, Module 3, Teaching Module. Training 1. What is tolerance? Training 1. What is tolerance? Tolerance. Requiring either a higher dose for the same effect or switching to a different medication altogether. Addiction, chronic relapsing disorder characterized by compulsive drug seeking and use despite adverse consequences. Potency. High potency means Haldol requires a low dose to achieve its result, low potency. Chlorpromazine requires a high dose to achieve its result, high potency. Kindling, the process where repeated exposure to subthreshold stimuli eventually leads to convulsive seizures. The nervous system remembers the past withdrawals. Relapsing has effects on the brain, worsens the severity of relapse rates and addiction with each successive relapse incident. Example, alcohol withdrawal lowers seizure threshold. Training 1. What is tolerance? Attention Deficit Hyperactivity Disorder. ADHD is a persistent pattern of inattention or hyperactivity, impulsivity, or both. It interferes with functioning and development. ADHD affects individuals' ability to focus and control their impulses. Signs of stimulant abuse. Inchworms telephoned incidents hoping aardvark averages improve marvelously. Insomnia, tremors, increased BP heart rate, heart palpitations, agitation, anxiety, irritability, mood. Specific facts about ADHD. Symptoms were present before age 12. Frontal cortex, it affects the basal ganglia. Reticular activating system, executive functions and behavioral, motor control, learning functions, and emotions. Ability to focus, fight or flight, regulating arousal and sleep-wake. ADHD neurotransmitters, dopamine dysfunction, norepinephrine dysfunction, serotonin. How to manage ADHD. Stimulants, amphetamine and methylphenidate. Symptoms, assess for cardiac history, ECG. Stimulants, side effects, increased heart rate, blood pressure, heart attack, and stroke. Amphetamines, approved for age 3 plus. Methamphetamine, approved for age 6 plus. If side effects are intolerable, especially tics, discontinue the medication and try a non-stimulating medication like guanfacine or clonidine or Strattera for age 6 plus. Non-stimulants. Guanfacine and clonidine are FDA approved for ages 6 to 17. For tics, stop the med. Strattera, atomoxetine. It's approved for age 6 plus. Non-pharmacological treatment. Behavior therapy. Patient and parents' cognitive behavioral training. Treat learning disorders. Family therapy and education. More facts. There's a high abuse potential. Insomnia, change the medication to morning time and provide alternative sleep medication. Adjust dose and duration. More facts. There's a high abuse potential. Insomnia, change the medication to morning time and provide alternative sleep medication. Adjust dose and duration. The ADHD screening scales. Conners Parent and Teacher Rating Scales, it's copyrighted. Vanderbilt ADHD Diagnostic Parent and Teacher Rating Scale is public domain. Monitor clinical progress over time. Monitor growth development milestones. Barkley Home Situations Questionnaire, Winder, Utah Rating Scale. ADHD. The mnemonic is fidgety, and this is for the diagnostic criteria. Fidgety. Functionally impairing, inattention, disinhibition, greater than normal, exclude other disorders, 2 or more settings, young at onset, less than 12 years old. The mnemonic for behavioral symptoms of ADHD related to hyperactivity, he riled up. Hyperactive, energetic, running around, interrupts, loud, effusive, delay intolerant, unseated, prematurely answers. For behavioral symptoms of ADHD related to inattention, which is 10% of cases, is details off. Details sloppy, easily distracted, task, avoidance, ignore instructions, lose things, sustained attention difficult, organization lacking, forgetful, fail to finish. Combined symptoms of ADHD, both inattention and hyperactivity, are 20% of cases. Mnemonic for borderline personality disorder, I despair. Borderline personality, the mnemonic is I despair. Identity disturbance, dysphoria, emptiness, emotional instability, suicide and self-harm, psychotic and dissociative, anger, impulsivity, relationships. Fear of abandonment, inappropriate anger response. Important for testing, DBT was developed by Marcia M. Linehan. You can use the letters DBT to remind you want to decrease behaviors. It's for borderline personality disorder and to teach. You deal with stress, self-management, regulating emotions, focusing on behaviors that don't serve the patient. Mnemonic for the goals of DBT are DC steps, improve then DC. Decrease crisis-generating behaviors, suicidal behaviors, therapy interfering behaviors, emotional reactivity, passivity, self-invalidation. Improvement in decision-making, communication. Mnemonic for the treatment of borderline personality disorder is DLAPS. Diagnose, educate, life outside treatment, avoid meds, prioritize, safety plan, expect change. Training 3, personality disorder. Ego dystonic is inconsistent with their self-concept. Ego syntonic is consistent with their self-concept. The personality disorders are divided into clusters. Cluster A, they're odd and eccentric. Cluster B, they're dramatic and erratic. Cluster C, they're anxious and fearful. Personality disorders cluster A, paranoid personality disorder, schizoid personality disorder, and schizotypal personality disorder. Personality disorders cluster B, antisocial personality disorder, borderline personality disorder, histrionic personality disorder, and narcissistic personality disorder. Personality disorder cluster C, avoidant personality disorder, dependent personality disorder, and obsessive-compulsive personality disorder. Remember 2-4 schizophrenia. Greater than 2 symptoms for a period of greater than 6 months. This is a good mnemonic for the basic symptoms, symptomatology of schizophrenia. HDBS network. Hallucinations, delusions, behavior, speech, negative symptoms. HDBS network. Remember, schizoids avoids. Schizotypal is a type of schizo. Comparing schizotypal to schizoid. For schizoid, there's emotional attachment and social disinterest. For schizotypal, there's eccentric behavior, odd beliefs, and psychotic-like symptoms. Working to break down the personality disorders into Cluster A, Cluster B, and Cluster C with easy mnemonics. Cluster A, pass on the party. Paranoid, schizoid, schizotypal. Cluster B, banned from the party. Borderline, antisocial, histrionic, narcissistic. Cluster B, banned from the party. Borderline, antisocial, histrionic, narcissistic. Cluster C, the party is dead on arrival. Dependent, obsessive, compulsively perfectionistic, avoidant. Cluster C, the party is dead on arrival. Dependent, obsessive, compulsively perfectionistic, avoidant. The essential facts of antisocial personality disorder. Mnemonic for the goals of DBT are DC steps, improve then DC. Decrease crisis-generating behaviors, suicidal behaviors, therapy interfering behaviors, emotional reactivity, passivity, self-invalidation. The fundamental traits of narcissistic personality disorder: extreme sense of self-importance, need for excessive admiration, preoccupation of success, sense of entitlement, exploitative behavior, lack of empathy, envy others, shows strong attitude. 4. Autism spectrum disorder. Facts: a persistent deficit in social communication and interaction across multiple settings, lack of social reciprocity, nonverbal communication, problems in developing, maintaining, and understanding relationships, fixed interests, stereotyped or restrictive, repetitive behaviors like hand flapping, insistence on sameness, hyper or hyposensory input. The signs and symptoms of autism spectrum disorder are associated with many medical conditions. Communication is delayed response to name and babbles, then stops talking. For social behavior, they're lonely and they miss social cues. They have repetitive behaviors, and there are other physical and medical conditions involved. Factors: male gender, intellectual disability, and familial history. Symptoms of autism spectrum disorder: no cooing by age 1, no single words by age 16 months, no response when called by name, little or no eye contact, toys are lined up in a particular way, intense tantrums, lack of imaginary friend, little interest in playing with others, short attention span, self-injury behaviors. The tools for screening for autism spectrum disorder: Modified Checklist for Autism in Toddlers, MCHAT. Autism Diagnostic Observation Schedule Generic, ADOSG. This is the gold standard. Age and Stage Questionnaires, ASQ. The ABCs of ASD testing tools. MCHAT. This checklist for autism in toddlers evaluates infants who are 16 to 30 months old and identifies mild symptoms. The CARS tool, the Childhood Autism Rating Scale, CARS, helps differentiate autism from other developmental delays. The ADOS, the Autism Diagnostic Observation Schedule, evaluates all ages and is considered the gold standard of assessments. The MRI, magnetic resonance imaging, to evaluate brain structure, and the EEG, electroencephalogram, to check for seizure activity. An additional thought. Note that Asperger's, there's no significant delay in language, cognitive development, or age-appropriate self-help skills. Abnormal nonverbal communication gestures, failure to develop peer relationships, lack of social and emotional reciprocity, inability to express pleasure in others' happiness. The pharmacological management. Antipsychotics are effective for symptoms such as tantrums, aggressiveness behaviors, prevention of self-injury, hyperactivity, and stereotyped and repetitive behaviors. Risperidone may be Abilify. Mnemonic for autism spectrum disorder is ASD. Aloneness, sameness, developmental. An additional thought. Note that Asperger's, there's no significant delay in language, cognitive development, or age-appropriate self-help skills. Abnormal nonverbal communication gestures, failure to develop peer relationships, lack of social and emotional reciprocity, inability to express pleasure in others' happiness. 4. Autism spectrum disorder. Remember the key things to watch for with Rett syndrome with the mnemonic RAT games. Regression of development, usually after 1 year. Girls affected predominantly. Autistic behavior, ataxia. MECP2 gene mutation, microcephaly. Epilepsy. Stereotypic hand movement. Remember the key things to watch for with Rett syndrome with the mnemonic RAT games. Regression of development, usually after 1 year. Girls affected predominantly. Autistic behavior, ataxia. MECP2 gene mutation, microcephaly. Epilepsy. Stereotypic hand movement. Remember the key things to watch for with Rett syndrome with the mnemonic RAT games. Regression of development, usually after 1 year. Girls affected predominantly. Autistic behavior, ataxia. MECP2 gene mutation, microcephaly. Epilepsy. Stereotypic hand movement. The primary action with Rett syndrome is referral. 6. Disruptive mood dysregulation disorder. DMDD. Diagnosis of depressive disorders in children and adolescents between the age of 6 to 17 years. 6. Disruptive mood dysregulation disorder. DMDD. Diagnosis of depressive disorders in children and adolescents between the age of 6 to 17 years. Use the mnemonic DICE to remember the specifics about DMDD. Depression, irritability, chronic dysregulated mood, episodes of intense temper outbursts, screening family history bipolar disorder. Treatment of DMDD is with mood stabilizers, antipsychotics, and SSRI medications. Okay, this is really important for the board exam. DMDD can coexist. They can have multiple diagnoses with ODD, IED, and bipolar, but it cannot coexist with MDD, conduct disorder, or SUDS, and ADHD. Training number 7. Intermittent explosive disorder. Rage disproportionate to the situation is the key thing to remember. Intermittent explosive disorder is an impulse control disorder characterized by sudden episodes of unwarranted anger. The disorder is typified by hostility, impulsivity, and recurrent aggressive outbursts. People with IED essentially explode into a rage despite a lack of apparent provocation or reason. Basic details. Children and adults. Intense tantrum. Verbal aggression twice weekly for 3 months or 3 episodes in 12 months involving damage to property. Symptoms: rage, irritability, increasing sense of tension, racing thoughts, increased energy, tremors, palpitations, chest tightness, temper tantrums, shouting, arguing, getting into fights, threatening others, assaulting people or animals, damaging property. Adult temper tantrum: throwing objects, fighting for no reason, road rage, domestic abuse. Outbursts last less than 30 minutes. Key features for intermittent explosive disorder: impulsive control disorder, a behavioral disorder, sudden rage and anger outbursts. Outbursts are triggered by identifiable stressor. Reaction far exceeds stressor, not due to other mood, anxiety, or behavioral disorders. For DMDD, it's a depressive disorder and an emotional disorder. Mood expression is significantly abnormal. Irritability is a core feature, and it impacts the environment and associates with dangerous. Training 7. Oppositional defiant disorder. Hostile, defiant. Disruptive behaviors that are negative, defiant, and disobedient. It's identified by losing temper frequently, easily irritated or annoyed, experiencing anger or resentment, defying rules or authority, annoying others intentionally, blaming others for personal mistakes, behaving spitefully or vindictively. The Dr. Lopez mnemonic for ODD is ODD, bad, 4, 6, real. ODD, oppositional defiant disorder, bad, blames, argues, defiant. 4-6, 4 symptoms for at least 6 months. Real, resentful, angry, easily annoyed, annoys others, loses temper. Pharmacological treatment. Therapy as the primary approach for this condition. Child and parent problem-solving skills training. Adolescent transitions program. Family therapy to enhance child management skills. Therapy to target mood and aggression. Adolescent Transitions Program, ATP. Individual therapy targeting mood and aggression. Adolescent Transitions Program, ATP. Individual therapy targeting mood and aggression. 9. Conduct disorder, more severe aggression than ODD. It is identified by a repetitive and persistent pattern of behavior in which the rights of others, social norms, or rules are violated. 3 criteria for the last 12 months and at least 1 in the past 6 months. Stealing, physical cruelty, running away or flight, destruction of property, deceit or theft, lack of remorse. The mnemonic ASRA PDL: aggression, stealing, running away, animal cruelty, property destruction, deceit and theft, lack of remorse. The nurse provider treats this by target mood and aggression. Medications that can be used include SSRIs, mood stabilizers, antipsychotics, and alpha agonists like clonidine and guanfacine. Individual therapy, family therapy. Conduct disorder is more common in boys than girls. It often co-occurs with ADHD. Early intervention and treatment can help improve outcomes for individuals with conduct disorder. It can lead to antisocial personality disorder. Number 10, Fragile X. The mnemonic is LEHAS, L-E-H-A-S, large head, elongated face, hyperextensible joints, abnormally large testicles, short stature. The response is to refer. The primary action with Rett syndrome is referral. Meaning 11. Major depressive disorder. Depression is the leading cause of disability worldwide, according to WHO. Dysregulation of dopamine, norepinephrine, and serotonin. Remember DNS. Cognitive and memory symptoms of MDD in older adults are often confused with dementia, pseudo-dementia. Remember apathy. Patients with MDD often respond with, "I don't know," compared to dementia patients who try to answer questions. Acute onset of cognitive dysfunction compared to dementia. For treatment, focus on using SSRI, SNRI, TCAs, and MAOIs. Psychopharmacological management. SSRI is the first-line treatment. Psychoeducation. Medication may take 4 to 6 weeks to show positive effects. Treatment duration 6 to 12 months. TCAs can cause cardiac dysrhythmias and have a higher risk of discontinuation syndrome. They should be avoided in patients with suicidal ideation. SSRIs are safer compared to TCAs. All antidepressants for patients under 24 years old contain a black box warning. Sexual side effects, add Wellbutrin. Wellbutrin increases dopamine and norepinephrine. TCAs increase serotonin, norepinephrine, but not dopamine. MAOIs increase norepinephrine, serotonin, and dopamine. SSRIs increase serotonin. For testing, remember, stick with SSRI, SNRI, TCA, MAOI. For suicidal ideation, stop medication. Working to avoid discontinuation syndrome. Effexor and sertraline are harder to stop. They have a short half-life. Prozac is easier to stop. Long half-life. Discontinuation syndrome is more common with short half-life medications like Effexor and sertraline. Non-pharmacological treatment. electroconvulsive therapy, cognitive behavioral therapy, CBT, transcranial magnetic stimulation, TMS, vagal nerve stimulation, VNS, phototherapy, and interpersonal theory, and CBT. Lexapro is the drug of choice when multiple drug interactions must be considered. Celexa, one of the worst for sexual side effects. EMDR. Mnemonic for EMDR. Helpful penguins are definitely incredibly busy creating recipes. History taking, preparation, assessment, desensitization, installation, body scan, closure, re-evaluation. History taking is gathering information about the client's past trauma or traumas. Preparation, building trust with the client and teaching relaxation techniques for self-regulation. Assessment is identifying target memories and negative beliefs associated with the trauma. Desensitization, using eye movements to process distressing memories. Installation, strengthening positive beliefs about the traumatic events. Body scan, releasing any lingering physical tension or discomfort associated with the memories. Closure, ensuring the client is stable and feeling safe at the end of the session. Re-evaluation, assessing progress, identifying new target memories, and making treatment plan adjustments. For EMDR, you must recognize the goal is to achieve adaptive resolution. Shapiro. (12) Electroconvulsive treatment. Major depressive disorder with psychotic features. Treatment-resistant depression. Contraindications for ECT. Cardiac diseases, compromised pulmonary status. History of brain injury or brain tumor. Inability to tolerate anesthesia. Some adverse effects of ECT may include cardiac arrhythmia, headaches, muscle aches, and drowsiness. Cognitive effects such as short-term memory disturbance and confusion. Training 13. Clinical management of suicidality. The mnemonic is CASTLE, C-A-S-T-L-E. Consider hospitalization. Always assume seriousness and danger. Social resource activation. Identify current stressors. Leave out safety contracts. Engage the patient with care. We have a handy mnemonic that covers most of these. SPAMWRAP, S-P-A-M-W-R-A-P. Suicidal attempt, psychiatric or physical. Age, marital status, white, recent loss, abuse substance, preferentially male, Clozaril for schizophrenia, lithium for bipolar. The mnemonic Mad Sparrow will peck faces. Male gender 45 or older. Age 45 for males, 55 or older for females. Divorced, single, or separated. substance abuse, psychiatric disorder, living alone, recent loss. For test taking, always prioritize by Maslow's needs hierarchy. The pyramid is bottom to top. Basic needs, psychological needs, self-fulfillment needs. The mnemonic for Maslow's hierarchy. Please select levels serving self. Physiological needs, safety and security, love and belonging, self-esteem, self-actualization. Training number 14, bipolar disorder. Message caps. Elevated mood with 5 to 9 symptoms, irritable mood with 4 to 9 symptoms. Message caps. Sleep disorder, interest deficit, anhedonia, depressed mood, guilt, hopelessness, worthless, regret, energy deficit, concentration deficit, appetite disorder, psychomotor, retardation or agitation, suicidality. Is easy. 2 blue weeks for depression, 1 fun week for mania. Training number 14, bipolar disorder. Mania, the mnemonic is dig fast. It can be euphoric or it can be irritable. The mnemonic for mania is dig fast. Euphoric requires 3 symptoms. Irritable requires 4 symptoms. 1 fun week, mania. Distractibility, indiscretion, impulsivity, grandiosity, flight of ideas, activity increase, sleep deficit, talkativeness. Mania, mood abnormalities and increased activity. Basic facts. Neurotransmitters in mood disorders: GABA, glutamate, dopamine, serotonin, norepinephrine. DNS plus 2 Gs. Bipolar 1 or 2. Bipolar 1, more severe, includes manic episodes. Bipolar 2, less severe, includes hypomanic episodes. Timeframes. Hypomanic episodes are a minimum of 4 days. Manic episode, minimum of 1 week. From Dr. Lopez, a graph describing bipolar 1 versus 2. For 1, full manic episodes, grandiose behavior, increased activity, decreased need for sleep, pressured speech, flight of ideas, and distractibility. For bipolar 2, hypomanic episodes, it's less severe. It causes little impairment, and it has major depressive episodes. Bipolar disorders. Bipolar 1. It's more severe and it does have to include mania, but not depressive symptoms. Mania for more than 7 days. Does not require depressive episodes. Bipolar 2. Less severe, must include hypomania and depressive symptoms. Hypomanic for 4 to 7 days. Once bipolar disorder 1, do not revert back to MDD or 2, but in remission, always bipolar disorder 1. The main tool for diagnosing is time frames. Mood cycling without meeting criteria for bipolar 1 or 2 or MDD. Children and adolescents for 1 year with irritability. For adults, 2 years. Psychopharmacological management. Lithium. It's the first line for bipolar treatment, the gold standard for manic episodes, used in mania, prophylaxis, and antidepressant augmentation. Ibuprofen interaction doubles serum levels. Check blood levels after administering. Lithium is neuroprotective. Lamotrigine for bipolar depression. Lurasidone for bipolar depression. Olanzapine and fluoxetine for bipolar depression. Divalproex sodium manages acute, manic, and depressive episodes. Carbamazepine treats manic episodes of bipolar disorder. Quetiapine, psychotic features. Non-pharmacologic. Cognitive behavioral therapy. Behavioral therapy. Interpersonal therapy. Support groups. Training number 15. Everything about thyroid values. You have to know the inverse relationships and understand more than memorizing. Thyroid facts. TSH. It's for diagnosing primary hypothyroidism. Normal values 0.5 to 5.0. Assess TSH first. Free T4. Normal values 0.8 to 2.8. Assess thyroid status. Rule out hyperthyroidism. Evaluate therapy. Value may increase during lithium therapy. Low T3 and T4, increased TSH secretion is hypothyroidism. High T3 and T4, decreased TSH, hyperthyroidism. TSH up, T3-4 down, hypothyroidism. TSH down, T3-4 up, hyperthyroidism. Hypodepression, hypermania. Primary hypothyroidism means high TSH levels due to low thyroid hormone. A picture from Dr. Lopez. Remember that TSH below 0.4 suggests that the thyroid is overactive. Levels above 5.0 suggest that the thyroid is underactive. The mnemonic for hyperthyroidism. What gifts men? What? Weight loss, hypertension, anxiety, tremors. Gifts. Goiter, increased appetite, intolerance to heat, insomnia, flushed skin, tachycardia, scant or irregular menses. Men, moist skin, elevated body temperature, exophthalmos, and nervousness. The mnemonic for hypothyroidism. LBW, punch calls. LBW, low sperm count, bradycardia, weight gain. Punch, pale, dry, and cool skin, puffy face, unable to conceive, nails thick and hard, coarse hair, heavy menses, and hypotension. Calls, cold intolerance, anorexia, loss of fetus possible, lethargy, sleepiness. 16. Liver function. Details on liver function. Aspartate aminotransferase is AST 9 to 40, school. Alanine aminotransferase, ALT, 5 to 30, labor, work. Elevated levels could indicate liver damage and ALT 50 times normal levels. Elevated glutamyltransferase, GGT, mean corpuscular volume, prothrombin time, uric acid, total cholesterol, and triglyceride. AST divided by ALT greater than 2. Decreased magnesium, calcium, potassium, blood urea, nitrogen, hemoglobin, hematocrit, platelet count, and albumin. Alcohol withdrawal causes a high risk of mortality. What medication do you give to someone with liver issues and alcohol withdrawal? Lorazepam. SIGCAPS. Sleep disorder, interest deficit, anhedonia, depressed mood, guilt, hopelessness, worthless, regret, energy deficit, concentration deficit, appetite disorder, psychomotor, retardation or agitation, suicidality. A graph of the common liver conditions: gallstones, primary sclerosing cholangitis, primary biliary cirrhosis, liver failure, ascites, hemochromatosis, liver cancer, cirrhosis, hepatitis. Number 17, conversion disorder. Conversion disorder. Can't version. Remember MASH. Functional neurologic disorder. Can't. Clinically unexplained abnormality, nervous system, trigger sometimes. Details about conversion disorder. Patients report unexplainable symptoms such as paralysis, paresthesia, blindness, or mutism. It is essential to consider conversion disorder as a differential diagnosis when no medical explanation can be found for sudden onset symptoms. Symptoms usually begin suddenly after a stressful experience. Abrupt onset of symptoms in correlation with a stressful event is a commonly tested aspect of conversion disorder. Extras, more conditions to know about: malingering and factitious. When you have an intentionally feigned illness, is it malingering or factitious disorder? Malingering always leaves, factitious always comes back. Malingering secondary gain, one-time visit. Factitious, enjoying the sick role, they return. Training 18. Adjustment disorder. Less severe event than acute stress disorder. Adjustment disorder is an emotional or behavioral reaction to a stressful event or changes in a person's life. The reaction is considered an unhealthy or excessive response to the event or changes within 3 months of insult. Adjustment disorder with depressed mood, depression, tearfulness, and hopelessness. Adjustment disorder with anxiety, persistent feelings of restlessness, nervousness, and lack of concentration. Adjustment disorder with disturbance of conduct, violation of social norms, for example, destruction of property, reckless behaviors, stealing. Adjustment disorder with mixed anxiety and depression, a mixture of the two examples above. Adjustment disorder with mixed disturbance of emotion and conduct, a mix of the above types. Training 19. PTSD. Post-traumatic stress disorder. Trauma. Trauma is the mnemonic. Traumatic event. Re-experiencing. Arousal. Unable to function. Month or more. Avoidance. PTSD mnemonic. Persistent trauma, stress disorder. Re-experiencing of a highly traumatic event with increased arousal and avoidance symptoms. Time-based distinction. Acute stress disorder lasts less than 1 month. PTSD lasts more than 1 month. At least 4 physical symptoms for more than 1 month. PTSD's diagnostic criteria include intrusion, avoidance of stimuli, and hyperarousal symptoms. Pharmacological measures for PTSD. Approved medications are sertraline and paroxetine. Prazosin for nightmares. Non-pharmacological measures for PTSD. EMDR, CBT, ERP, supportive group therapy, relaxation therapy. Group therapy provides social support, perspective, and opportunities for individuals to share their experiences. The risk factors for PTSD. A first-degree relative with major depressive disorder. Before the trauma, genetics, age, sex, mental health history, personality traits, and prior trauma. During the trauma, the level of exposure, the intensity, and the perception. After the trauma, access to resources and social support. Training 20. Obsessive compulsive disorder. Risk factors. First-degree relatives, parents, siblings, children with OCD. High-yield fact is streptococcal infection link. PANDAS. Sudden onset of OCD symptoms in children could indicate pediatric autoimmune neuropsychiatric disorder associated with streptococcal infection. Pediatric autoimmune neuropsychiatric disorder associated with streptococcal infections is PANDAS. Logical care for OCD. SSRIs like Zoloft and Prozac, often at higher doses than used for depression. TCAs like clomipramine. Frequent quiz fact, higher dose SSRIs for OCD. Non-pharmacological. CBT, ERP, high-yield fact. CBT is considered the gold standard for treating OCD. Subtypes of OCD. Contamination obsessions with cleaning compulsions, hoarding, symmetry obsessions with ordering compulsions, obsessions without visible compulsions, harm obsessions with checking compulsions. There's ego dystonic, inconsistent with their self-concept, and there's ego syntonic, consistent with their self-concept. Obsessive compulsive disorder. I murder. Obsessions. Intrusive, mind-based, unwanted, resistant, distressing, ego dystonic, recurrent. I murder the compulsions. Compulsions help to calm the obsessions. Training 21. Tics and movement disorders. The mnemonic is tic. Transient, irresistible, contraction. Tourette's syndrome. Rett syndrome. 2 forms of tics, 2 motor and 1 vocal. Tics and movement. Dopamine, norepinephrine, and serotonin are the neurotransmitters involved, DNS. Motor tics and at least 1 vocal tic many times a day, every day. A year since tics started, less than 18 years of age when startup, not necessarily simultaneously. Tics, sudden, brief, intermittent movements or sounds are the hallmark. Persistent, chronic motor or vocal tics disorder, not having 2 vocal and 1 motor tic. Tics not due to medical condition or meds or drugs. DNS is also the neurotransmitter combo for MDD, ADHD, and Tourette's. The pharmacological care, atypical antipsychotic, FDA approves Haldol, Pymozide, aripiprazole. Clonidine and guanfacine help with impulse control and rage. Non-pharmacological. Behavior therapy, CBT, high yield. Dopamine, norepinephrine, and serotonin play a role in the pathophysiology of Tourette syndrome. Motor tics characterized by sudden, brief, intermittent movements are often seen in individuals with Tourette syndrome. Tics and Tourette syndrome do not result from a medical condition or medication or drug use. Non-pharmacological approaches such as behavioral therapy and cognitive behavioral therapy can also be effective in managing Tourette syndrome. Pharmacological management of Tourette syndrome may include atypical antipsychotics such as haloperidol, Pymozide, and aripiprazole. Recall that dopamine, norepinephrine, and serotonin are involved in Tourette syndrome. Frequently tested. What neurotransmitters are involved in Tourette syndrome? What are the key features of Tourette syndrome? What are the management options for Tourette syndrome, both pharmacological and non-pharmacological? What duration is required for diagnosing persistent chronic motor or vocal tic disorder? Training 22, schizophrenia. Training 22, schizophrenia. Training 22, schizophrenia. Schizophrenia. The neurological defects: enlarged ventricles, reduced symmetry in the frontal, temporal, and occipital lobes, hippocampal and amygdala reduction, decreased cerebral flow, excess dopamine, excess glutamate, decreased GABA, decreased serotonin. Low GABA serotonin equals depressed flat affect. Increased glutamate dopamine in the mesolimbic area equals psychotic features. Thinking on the etiology of schizophrenia: inadequate synapse formation, excitotoxic death of neurons, excessive pruning of synapses, intrauterine insults, oxygen deprivation, prenatal exposure to toxins, maternal malnutrition, age 25 to 35. Age of onset for schizophrenia is a huge determinant. Males 18 to 25, females 25 to 35. Huge determinant. Some details. There's a neurological deficit. The example is enlarged ventricles are observed in brain imaging of individuals with schizophrenia. Neurotransmitter involvement, excessive dopamine levels in the mesolimbic pathway gives you the positive symptoms. Decreased dopamine in the mesocortical pathway gives you the negative symptoms. Nigrostriatal pathway, decreased dopamine and increased acetylcholine. Tuberoinfundibular pathway, decreased dopamine, increased prolactin. The mnemonic for schizophrenia symptoms: Hansel danced, really happy, giggling, making silly sounds. Hallucinations, delusions, referential thought, hostility, grandiose, mania, suspiciousness. The A's for schizophrenia: affect flattening, alogia, avolition, apathy. Students often get tested on the neurotransmitter involvement in schizophrenia, with emphasis on excess dopamine and decreased serotonin. Questions related to the age of onset in males and females are commonly asked on quizzes. Etiological factors such as inadequate synapse formation and intrauterine insults are frequently tested. Identification and understanding of positive and negative symptoms are crucial for scoring well on quizzes about schizophrenia. Some studies have found that eye movement tests can accurately distinguish schizophrenia cases from control subjects' abnormal jerky movements. Pharmacological. Second generation antipsychotics, 5-HT2A, Ziprasidone, lurasidone, and aripiprazole are the least sedating medications and least weight-gaining. Clozaril is an effective second-line medication. Atypical second-generation meds are commonly used. Non-pharmacological group therapy can help manage schizophrenia. Individual therapy is beneficial for schizophrenia patients. What is ACT? Assertive Community Treatment, ACT. Community-based programs that encourage and prepare patients for successful community living post-hospitalization. Includes case management, problem solving, social skill training, and support teaching on a 24/7 basis. Ensures placement of chronically mentally ill. Services in the home for patients with severe mental illness after the patient returns home. This helps patients, especially those who have long-standing history of noncompliance. They can benefit from ACT and case management. IGA for the non-pharmacological. Individual therapy, group therapy, assertive community treatment. Monitoring. Routine labs should be conducted. Weight, BMI, and waist-to-hip ratio should be measured. Serum glucose, hemoglobin A1C, and lipid panels should be monitored. Liver and kidney functions should be assessed. Complete blood count should be done regularly. An annual eye exam is recommended, especially for patients on typical or Seroquel medications. Routine labs should be conducted. Low ABC, glucose and lipid panels, labs, obesity, BMI, waist-to-hip ratio, weight, annual eye exam, blood count, liver and kidney functions. Students are often asked about the side effects and adverse reactions of specific antipsychotic medications like ziprasidone, lurasidone, aripiprazole, and clozaril. Understanding the concept of assertive community treatment, ACT, and its role in schizophrenia management is frequently tested. Commonly tested monitoring aspects include the need for routine labs, checking serum glucose and lipid levels, and assessing weight and BMI. HDBS network for schizophrenia. Hallucinations, delusions, disorganized behavior, disorganized speech, negative symptoms.